tapeworm usually it has like a hook, and it will go into the intestine. It hooks itself to the intestine and sucks the blood. Hookworm is usually, what does it do?
Goes through the feet, right?
Not really.
Or other
Usually it's with the food.
No, it hooked on the Begensteiner like this.
And what does it
eat
do?
Every vitamins and every
Yeah, you're close. That's why
good thing.
it's called hookworm anemia, or it's called iron deficiency. Hookworm iron deficiency, because it sucks the blood. So patients will get to anemia. And usually if the patient has anemia, the first thing that you do will be take the stool. If you take the stool and if you get hookworm, you treat that one, they will be cured, okay? You don't need, it's called, the other name here in America is called hookworm, it's called ankylostoma duodenale. Can you see? Look how it looks like, look. It's ready to eat. Look. His teeth.
Oh yeah. Yeah, no, I'm saying hookworms, they go through the feet, right?
Huh?
Don't they?
No. When you eat something.
Oh, when you eat something. Ooh.
Huh? This is the other name. It's called ankylostoma duodenale.
And the other name, ankylostoma.
Okay, yeah, you're right. Hookworm, it goes with the larvae gets into the
feet.
yeah.
Through the feet. Yeah.
And then it gets like a larva into the
Yeah,
bloodstream.
they go in your mouth, and then when you cough and you swallow, they go into your tummy. That's how you get it.
Yeah. The other thing is ascaris. Ascaris is the one that's doing ascaris.
And hookworms.
Yeah, ascaris. The one that ascaris. Can you see? It's a small intestine roundworm. This one, usually it comes through the lung, it goes into the lungs sometimes. From the intestine, it comes like this, and it gets to the lungs. And then in the lungs, it will lead to infection. Yeah, it's called Ascaris eosinophilia. But that one, the hookworm, is, it gets through the foot, and then it's called Ascaris lumbricoides. Usually there is also the pigs. The pigs are affected. Can you see? This one is through the food, and okay. Let's say you don't clean, you don't do anything. It's not common here actually. It's not common. It's more of African and Asian problems.
Through the food. Amebia also.
Amoeba, yes. Amoeba. Okay, so hookworm usually leads to iron deficiency anemia, and if you treat that, ascaris, it can lead to very serious abdominal pain. I got a patient with this. He comes with what we call a board-like abdomen, and you think that the patient has appendicitis. You think it was surgery for that patient, okay?
This is
And then
similar to
when
hookworm.
stool is being done, we send to some other, and then they do stool and they send it back, and no need of surgery. That means we gave him the medication, and then it's gone. This is very like it leaves the abdomen like very like hard. It's called hard board like abdomen. That means very painful and everywhere like hard. Look just like an appendicitis. And as you've mentioned, this is the one. Ascaris is the one that gets into the lungs, leading to Ascaris eosinophilia. Ascaris eosinophilia. Human eosinophilia. This is like this one. Ascaris lumbricoides. Okay, I want to show you like it's moving.
Ascaris lumbricoid. Bathwosny. The largest nematode to infect the human intestine. Taxonomy Kingdom, Animalia Phylum, Nematoda Class, Rhabditio. Order, Ascaridida. Family Ascarididae. Genus, Ascaris. Species, Lumbricoid. Geographic distribution. Up to 1 billion people worldwide are infected. Both tropical and temperate areas. More common in tropical and subtropical. In the United States, southeastern states, children are most commonly infected. Morphology 15 to 35 centimeters long and the diameter of a lead pencil. Female, straight posterior. Male, curved posterior, button hook tail. Morphology. Both male and female have 3 anterior lips with small, tooth-like projections. Morphology fertile eggs, 45 to 75 micrometers by 35 to 50 micrometers. Thick hyaline wall around a one-cell stage embryo. Brown, bile-colored outer layer. Decorticated, no mammillated outer coat. Unfertile eggs, up to 90 micrometers. Elongated with mass of highly refractile granules. Life cycle. Life cycle definitive host, adult worms, humans live in lumen of the small intestine. Female can produce 200,000 eggs/day. Passed in the feces. Life cycle eggs, in the environment unfertilized, not infective. Fertilized, embryonate. Infective after about 18 days depending on the environment. Optimum, moist, warm, shaded soil. Life cycle human ingests infected egg, fecal oral route. Larvae hatch inside the human host. Invade intestinal mucosa. Carried through systemic circulation to the lungs. Larvae mature here, 10 to 14 days. Penetrate alveolar walls into the throat. Swallowed. Small intestine, adults. Dum dum dum. http://www.indiarocks.com/videos/why is eating dirt is bad. Ascaris lumbricoid 2,296,565. For your information.
Okay. Okay, then just to see some of the parasites. Okay. Okay. We done now antihistamines.
It's for blood.
What do you mean by histamines?
Allergies.
Yes. These are chemical substances that are produced by what we call mast cells. Mast cells. So let's say when you have a certain pollen gets into your nose, okay, and then what happens that those pollen they attach to the mast cells, okay, those pollen, the antigen, and then this is called degranulation. The mast cells will degranulate. It means it will burst out, boom, and then the histamine that is inside will, boom, okay, it will expose, and then the histamine will cause what? A reaction in the body. All the reactions is
Yeah, bless you.
okay. And then what? Any skin rashes, any itching. Oh, my eyes itch. Okay, all this will be because of the histamine. So what do? You give medication against what? Against histamines. So some medications, some other medications, what they do is that they stabilize the mast cells. You see, they make the mast cells not to burst out. For example, these are newer medication for asthma. You know asthma, bronchial asthma? These are called chromolines. Chromolines. Is there a name here written? No. But these are like like very recent medications. You see, these are sodium works by prevent the release of substances in the body that cause inflammation. Cromolyn sodium inhalation is used to prevent bronchial asthma. You see, it's what we call a stabilizer. It will stabilize the membrane of the mast cells. Okay, cromolyn. Let's see. Let's learn something, no problem, okay?
There are many different medications that patients with asthma take to control or prevent their symptoms, and they come in several different dosage forms. Some medications come in tablets, liquids, or capsules that are taken by mouth. Examples of these include prednisone tablets, methylprednisolone liquid, albuterol tablets, and theophylline capsules. However, most of the medications are inhaled directly into the lungs so that the medication is delivered directly to the site of action. The first category is the fast-acting medications, or what is called rescue medications. These medications work very quickly to relax the smooth muscle in the airways and decrease the constriction of the bronchioles. They are used when patients are having trouble breathing and need immediate asthma relief, like during an asthma attack. Examples of rescue medications include albuterol inhalers, also known as Proventil or Ventolin, also terbutaline, which is also known as Breathair or Breathine. Another example is ipratropium, also known as Atrovent. And then when they have the combination of albuterol and ipratropium, known as Combivent. These medications come in a number of dosage forms, but are most often administered by inhaler or nebulizer for immediate relief. If the asthma symptoms are severe, the doctor might also prescribe a steroid to be taken by mouth to decrease the inflammation and swelling in the lungs. Examples of steroids might include methylprednisolone, also known as Medrol, prednisone, also known as Deltazone, Orazone, or Liquid Pred, and then finally prednisolone, also known as Prelone or Pediapred. The other category of medications includes all of the longer-acting medicines. These medications treat the underlying inflammation that is present in the airways and decrease mucus production. These medications are taken every day on a scheduled basis to prevent or decrease the number of asthma attacks that a patient may have. What this means is that patients may need to take the medication a prescribed number of times each day, regardless of if they are having an attack or not. These medications should never be used in an emergency or used to treat acute attacks because they do not work quickly enough to provide the relief. Some examples of long-term control medications include inhaled medications like beclomethasone, or also known as Beclovent, budesonide, also known as Pulmicort, flunisolide, also known as Arabid, fluticasone or Flovent, triamcinolone or Asmacort, cromolyn or Ental, metacromyl or Tylade, salmeterol or Ceravent, and then the combination of fluticasone and salmeterol, which is known as Advair. Oral long-term medications include Zafirlukast or Accolate, Xylutin or Zyflo, theophylline, also known as Theodor or Slobid, and then albuterol extended release, which is known as Volmax or Proventil.
You see, there are many medications. Yeah? So just your task is to know only those that are here. Okay. Okay. Really, everything is like a lot. So let's stop this one here. And let's discuss a few questions. So this one I will give it to you, okay? Do you want to print it for you? How many copies? 7?
7.
3, 4, 5, 6, 7, and and then we'll discuss just let's see some questions from the medical assisting. So tomorrow we'll continue on this part, okay? At least tomorrow after 12. In the morning we will discuss phlebotomy. Okay, and after that we will discuss contrast. So we will continue this one to certain point. Okay? So my thing is just to show you where to focus and what some things are. Okay, what's your job? Your job is to go and revise whatever that we discuss here, and then to fix it into your mind. Yes. And there is a study technique which is called SQ3R technique. Do you know that? It's called, I think Akbar knows it. Do you know Akbar? SQ3RS? SQ3R studying technique. S means surveying. Okay. Q means question. Then 3R means read, recite, and review. This is the technique that helped me when I do my 12th grade, when I study to go to college or university, and I was studying this technique, and it still is a modern technique. If you go online, you can't get this book. They're writing. It's for 3Q. So always first what you do will be, let's say, I want to study this book, yes? What you do is that first survey. That means see just the topics. What does it include? See the outline. Okay, see tables, pictures. Just you survey first. Okay. Okay. Well, what is here? What is here? What is here? Finish. Then now you start. Okay, reading, and while you are reading, you start questioning. Then when you read, you recite. Recite means you can recite in two ways that I know. One is you say the words again and again. Let's say if I want to remember Akbar, what do I say? I say Akbar, 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 Akbar.
Yeah.
Usually I say 12 times.
Yeah.
Yeah, then after 12 times I don't forget it.
Yeah.
Yeah?
What
And
is the maximum number of recite? 12 or 11? How many times?
yeah, it depends up to you. It can be 3 times. But
How do you memorize?
But 10, 12 times is good. That means
Yeah.
it's like law, okay? And then write them. How do you write? Write the same 10, 12 times.
Yeah.
Okay, let's say medical terms. Write them. And those that you write, keep them.
Yeah.
Okay? And then at the end, now you review. Now you go to this chapter and you revise. Yeah, you have those that you wrote. And this one, now you revise it. So always when you do like this, then you can really keep it in your mind, yes?
This is the thing right, but there is no right in this one.
Yeah, we divide recite into 2. Write and oral words.
Maybe read, maybe recite, maybe.
Recite or memorize or
But
Yeah,
actually,
right.
this is very, famous technique. On YouTube, they are giving a lot of,
Is that this one or another one?
No, this one.
This one, yeah.
This
You saw it? Okay.